Hello, everyone. This episode is dedicated to research that either I see as less important or that I don't have time to cover. And some people might find these studies very important and might ask why I didn't present them to you. So if you find any information that is very important, information that benefits you, tell me that this thing is important and we want you to focus on this topic and bring it to us in detail. Just wait for people to join and let us know about the sound. Then is everything okay? Okay. We are good now. People have joined now. So we encounter research. I'll start with all the research. The first study tells you how fasting protects against inflammation. Researchers at the University of Cambridge found that fasting reduces inflammation, and fasting reduces inflammation resulting from the immune system. Okay, I'm just reading the English and translating it to Arabic. I don't want to read in English and then translate it to Arabic. And this is important in many chronic diseases. This is a study published in a journal called Cell Report, a very prominent journal. And of course, the University of Cambridge is a very prestigious university discussing this topic of inflammation and how fasting reduces it. And of course, it is very beneficial for diseases like obesity and type 2 diabetes and things like that. A beautiful and important study, but unfortunately, there isn't time for it. Another very important study talks about an active substance in olive leaves. A substance called hydroxytyrosol, a substance found in olive leaves, and another one called oleuropein. Their substances are present in olive oil at a rate of 1%. They are present at 100 times that amount. So if they are in olive oil at a certain amount, they are in olive leaves at 100 times that amount. All right, so what is their role? The research published in a journal called Nutrient, the Nutrition Journal, talks about the role of these two substances, hydroxytyrosol and oleuropein, which are the active substances in olives, whether in the leaf or in the oil. And we mentioned that in the leaf, it's 100 times more than in the oil. They protect against aging, meaning anti-aging for old age and all the disorders that accompany it. The research focused on the nervous and muscular systems and on the composition of bacteria in the gut microbiome. It focused on a very beautiful study showing the benefits of olive leaves or olive oil extract from them. Of course, if one takes the extract itself, it would be better than the leaf itself. A beautiful study, very nice. But unfortunately, time, I'm just showing you how we come across extremely important research for the viewer, and there's no time for us to make an episode about it. He comes and tells you what? A comparison of the effectiveness of diabetes medications in reducing albumin in urine, okay? In type 2 diabetes, a complete comprehensive review on this topic. They brought diabetes medications and looked at how effective they are in reducing albumin in urine. What does reducing albumin mean? It means protecting the kidneys. Okay, it fixes our kidneys. Which of the diabetes medications will be the hero that can repair the kidneys and help in this matter? Let's just see the result right away, because what? The conclusion, which is what? The summary of the research. He says, among all the new diabetes medications, there's a group called SGLT2. I'll tell you about it now. It led to a very good reduction, meaning it had a great result. So what is this strange name, SGLT2? You have a diabetes medication, and you might find a box with a name like Farxiga. Okay, that might be its original name. I mean, I'll mention the active ingredients, and you'll know because, of course, no one can memorize all the brand names. For example, you might find a name ending in gliflozin, dapagliflozin, empagliflozin, which is what?
Almost Jardians, meaning you will find the active ingredient name ending with glyphosate. And they say these medications lower blood sugar by removing it from the body through urine. You might say, yeah, but doesn't this cause harm? Well, I would say for some people, a very small percentage, it might cause, yes, it might cause microbes in the urine because the sugar in the urine can, a microbe might live on it.
Welcome. Hello and welcome. Isar and Azma Aldalia. Hello to you. Welcome. By the way, I will say, wait, and I can answer any question during this episode because it's a chat episode where we discuss different studies, summarize them, and talk about their benefits and whether they are worth delving into in detail. So for those who have a drug with the active ingredient ending in gliflozin, I don't remember their brand names, okay?
He will be happy, delighted, because his blood pressure will improve and his kidney will be pleased.
And there are other studies that said his brain will be happy, protect from, and his sugar, of course, they are diabetes medications, will be happy, and his weight will be happy. So it's something really, really, really nice. So this is the summary of our beautiful research. So what is this regarding the comparison between all diabetes medications?
Which of you knows the diabetes medications that can protect our kidneys? You know, if the kidneys fail, it's a big problem. All right, come on.
What do they do? A very nice title, a beautiful study that says what low inflammatory diet, meaning a meal or food that reduces inflammation. Food that reduces inflammation. You might ask what food reduces inflammation. We will see it in the research. What is the importance of the research then? Foods that reduce, and here what is meant by inflammation? The inflammation that causes aging, making us older and tired. It's called an anti-inflammatory diet, meals against inflammation. So what about it? Associated with lower incidence of diabetes, it is related to protecting against diabetes. So it is clear that we should focus on its role in diabetes prevention. Okay, and the role of diabetes-related genetic risk. The important thing is that let's also look at the summary, since I can't explain what they did, what they made, what they brought, and why. It says that it reduced the risk of diabetes. So diabetes might occur, right? And it improved the blood sugar levels in those who are in the pre-diabetes stage. I just want to quickly get into the research about what. No, we won't be able to quickly get to the details of the anti-inflammatory diet. Okay, what is the food that's
anti-inflammatory?
This regarding cancer, folks. As I was saying, it's not easy to just rush and get medications and immediately take them. I mean, I also want to say that the topic of cancer is not an easy thing. Brain quality is a very nice name, really. We all need this brain quality, and 450 would be very nice. It's a very nice name, brain. Where is this brain quality from, sir? What does it say? What is the reason for the sudden appearance of red spots for about a month on my legs? This could, of course, need to be seen and checked, and it might be blood pooling, like increased blood thinning or something. Of course, this is not a final diagnosis, just a bit of increased blood thinning. So what caused these red spots? A vascular or blood doctor needs to see it quickly. A vascular or blood doctor needs to see it quickly to understand what's going on. Is it that I'm taking lipoic acid? Yes, maybe. It could be a possibility, but lipoic acid is a bit more well known.
In terms of causing allergies, many people have allergies and itching because of it. The histamine released from this allergy might have dilated the vessels and caused these red spots. But this is for someone with fibromyalgia and nerve damage. We did an episode on the topic of fibromyalgia and the new treatment that came out for it, milnacipran. And we explained how it is diagnosed, the locations of the tender points, and specific pain areas. It was a very difficult disease to diagnose, and now it has a good diagnosis. Of course, may God help you, because it is a very painful disease. Indeed, it has significant complications, but it doesn't have a cure. A cure meaning a complete recovery. However, there is pain relief treatment. And we mentioned the latest medication for it, which some people take, gabapentin. You might find medication that is taken before sleep, and some people take it with duloxetine, and then there's the new milnacipran we mentioned. This is for fibromyalgia and all these painful nerve diseases.
It becomes very exhausting for a person.
So that's regarding the meals that are anti-inflammatory, okay?
A study discussing the latest treatments for diabetes in children and adolescents. What happened in this matter with children and adolescents, and what does it mean they recently discovered that? Let's quickly get into it. Because diabetes now affects children. And of course, type 1 diabetes in children is well known, but type 2 diabetes in a child or a teenage kid who is at 14 or 15 years old and they get diabetes, I feel upset when I see a child who is overweight and obese. Nowadays, there are many such children, and consequently, they might develop type 2 diabetes. What are we going to do with the first one? This is an autoimmune disease, okay? So here, regarding the medication, it says the medications, the research needs to be comprehensive to get all the details. But from its summary, it says, like the gliptin family, for example, those that end with gliptin, okay, like allogliptin and such. Of course, each country has a different name, so I can't bring the names now and list them. And this, and the glucophage and all that. What does all this mean? We need to delve into the research details and find out which medications are effective for treatment. And of course, this is more relevant to doctors. The one who takes this research and knows when a child comes and confirms that the diabetes they have is not type 1, type 2, then they start with what they call the first line treatment. Yeah, they get it from these studies. A very nice study. Of course, I've received a lot of research about aging. What does the study say? Do your organs age at the same rate, or does one organ age before the other? A very nice and beautiful study. Its details tell you that they found, in short, that not all body organs age at the same rate. Yeah? Some people have organs that age quickly, and this can destroy them. That's the idea of this topic. Of course, it's a very nice and beautiful study that shows us how one organ ages differently from another, how one organ deteriorates, and how they figured this out, or how did they know. What makes them take a small piece from each organ, or from the secretions of each organ, or from the cells of each organ, and determine its age? And how do they know the age of that organ? Not your age. Your age is 70 years. Yeah, but how old are your eyes? How old is your heart? How old is your liver? So there are the nice song group from the songs. They go to these people and find out which organ is tired, its age, the age of that organ, and then they start to see how to solve the problem of these tired organs. There's a new medicine. Maybe I did an episode about it for the rheumatoid. I did an episode about it, or something similar to it, or something. Very nice research. I didn't. Oh, this isn't available. Okay. Because it almost says what...
the title of the research, because I will look for its link. What does the title of the research say? Women's tears.
When a woman cries like that, it could lower anger levels in men. Okay, so when a woman starts crying, and that's a nice weapon, the woman cries, the tears fall. They found that the tears have a scent that comes out. You don't smell it or recognize it. This scent calms a man's anger. So I advise any woman when she finds her husband upset or angry, according to this research, not my advice, just according to this research. And if you want, I can get you the details and we can see what this scent is that the man smells without realizing it after he was agitated and about to throw something or whatever. He calms down and starts to... So this is a study, interesting, about women's tears and how they calm men's anger. All right. Also a study about a new medicine called sobexagliflozin, one of the gliflozins family that we have in Egypt. So they keep coming up with newer things, and they talk about its effectiveness and all that. So we have it. We have a lot of it. Also a study. What does this research say? Published in what? Nutrition and Diabetes. The Nutrition and Diabetes Journal, it talks about indicators in urine. Things like indicators from urine, things we take from urine for patients with type 2 diabetes who have vascular problems and those who don't. What does it mean for those who do not have microvascular problems? It means having an issue with the eyes, diabetes starting to affect the eyes, diabetes starting to affect the kidneys, the blood vessels. These, we say they have microvascular complications. Okay, so there are indicators. What are these indicators and such that they have, that we can see? Things from in the kidneys, okay? It might help us monitor the function, meaning the kidneys are working well. It's something called, here is the name of a substance. It might help doctors measure its level to know how much the disease has progressed in the kidneys. And these kidneys, of course, this is the microvascular, how much the kidneys have started to deteriorate to suffer from diabetes. The doctor sends to request this standard or indicator to know exactly how the kidneys are doing.
What also, a study tells you what? The relationship between, what's the name? The waist, which is what?
Which is this waist measurement, how many centimeters. You get a belt, a measuring tape, and measure the waist. The waist to hip, which is the belly, and the hip, which is the backside or something like that. Waist to hip ratio, this ratio. Of course, as a person gets older and their belly grows, this ratio becomes completely imbalanced. Its relation with diabetes. I can know if you will get diabetes or not. I get the tape and measure around your stomach and measure again a bit lower. And I can know with a certain percentage if you are approaching the diabetes stage or not. A beautiful study, and you will find the numbers and this level, and each person can apply it at home. They can get the measuring tape and see to find out the measurement and then apply the study's findings. There was an equation called something like Ismba or something. There was also research about the Mounjaro. The Mounjaro, guys, is the top weight loss medication we have. The injection is taken weekly for weight loss. It causes significant weight loss, but it's very expensive in Egypt, costing around 30 to 40,000 pounds or more. And God knows, it's a monthly payment, but it's currently the most effective for weight loss. Another study tells you that the microbes of the gut, the beneficial microbes that are good for the stomach. Okay, what is their relationship to changes in them, improving them, and enhancing their quality? What is their effect on diabetes? How beneficial will it be for diabetes? It's a study worth getting its details, because if a diabetes patient, how much will they benefit from this microbiota, which is the which is for... He asked me saying, "Doctor, make an episode about how to..." Drinking parasite medication. Sure, I will do it. I had done a few episodes a while ago, like 2 years or something. I will try to see what's new in this topic, God willing, and we will update it. I also learned that some of these medications have become very scarce. The spots started to fade in the abdomen. These red spots after consuming a mixture of garlic in an increased dose with white vinegar in an increased dose with a capsule of alpha lipoic acid along with a main meal.
All right.
Doctor, please answer us, Tarek, or is the question coming me? He tells me I have breast cancer. I want to take a parasite medication. Well, look, in a live broadcast I did today before this, you'll find I talked about that parasite medication and its dosages plus the episodes, okay? But of course, we must go back to the doctor. We must go back to the doctor in... Oh, there is an episode or research about the iron, the iron in food. They say that dietary iron in food is not a supplement, meaning, and it's not taken as a supplement. You go and get a vitamin medicine that contains iron. No, the iron content, and it's well known that iron is very abundant in things like meats and such. Predict all cause and carte means it predicts that the mortality rate, of course, expected from any cause, meaning any cause, whether any disease, and vascular diseases in diabetic patients. If there was something, but the summary says that our research found that there is a relationship. It's not a sin, meaning the iron that is taken in food is somewhat related to the deterioration of health that ultimately can lead to a person, possibly losing their life. And that higher iron intake means an increased consumption of iron. People who go and get iron supplements and such, it increases the risk, especially in men, okay? But it has a positive protective effect in women. A very interesting study differentiates between men and women on the subject of iron. If we rely on this research and delve into its details, of course, we can't judge from just a couple of words in this summary. That's iron as a dietary supplement is not good for men, but is good for women. Research on smoking and diabetes. The group that has type 2 diabetes and smokes, these people mean they are committing a crime against themselves. Besides, this research might tell us whether smoking is one of the reasons that accelerate a patient developing diabetes. Okay, so it says that, smoking is also related to damaging beta cells. Those beta cells, guys, which are the pancreatic cells that produce insulin. Smoking accelerates their deterioration. Okay, but to some extent, the topic is still not well studied. The new smoking products that are coming out, strange things are coming out. I once entered a shop with a machine. I'm used to that to grocery stores that sell cigarettes, having a big cigarette shelf behind the counter, but I found a small cigarette shelf and another big shelf full of boxes. The store is in front of the university, so it's targeting the university students, So I asked him, what are these boxes? The cigarettes are new types that you don't know. You're used to 3 or 4 types in Egypt. He told me, no, these are electronic cigarettes in boxes like this, something
electronic cigarettes are widespread, and one wants to make an episode about their harms and or whether they are whether their harms are less or more than regular cigarettes.
So all of this is the dangers of cigarettes on diabetes patients or causing diabetes.
Research then, natural substances and their effect on aging from the natural things. Okay, of course, this would be a very nice thing if one finds it. I will try to get you some examples of it. No anti-aging. Things that contain phenolic, like olive oil and fruits and such. And so the names of the active substances are in the summary. So you need to delve into the research and find the plants that are the most important. And the most important thing about these plants is how we take them, right? How much do we consume? Another important study tells you that the microbiome bacteria, there are many studies on the microbiome from here, this beautiful one inside the abdomen. It tells you that it has a role in treating constipation. So constipation has a role in chronic constipation, meaning it can improve your chronic constipation. Natural medicines, or rather natural compounds to protect against the stopping of the enzyme that destroys nerves in diabetic patients. Remember, we mentioned medicine for those who have nerve inflammation due to diabetes and their legs and hands feel numb and their nerves hurt them. Well, finally, they found a treatment. A medicine, and this medicine is only available in India and Bangladesh, and it's hard to obtain. They say it has been released in Kuwait. And the diabetic patient must not have had the disease for more than 10 years, including the period when the disease was not yet discovered, so that the nerve is not yet damaged, because it stops the deterioration, not reversing the situation. So there are natural things that work similar to its function. The most important thing is you might find the most important thing just by looking at the research like that.
The most important thing in it is green tea.
We need to get the research and go into detail on this topic and the things that contain tannins. The tea, the brown tea, of course, it is not recommended to drink green tea with sugar, or the regular brown tea with sugar. Of course, there are many other things, but there's no time for, we can't, right? We want to get the research. It's a huge amount of research. I don't want to take too long, because I know this episode might be difficult and might be boring. It might be a strange way. All right, so let's take the last one and wrap up this topic and tell me your opinion. All right, tell me your opinion on this type. Because I can't explain all this research, everyone. Because it takes a lot of time to get the research, get its details, and prepare the episode. And even if the episode is live and you start talking right away, there's no preparation, production, and the topic takes a lot of effort.
Let's take the last thing, diabetes and gout.
This is a very important topic. Well, folks, diabetes and also gout. Gout, the crystals that they say come from meat, but some people are already predisposed to this gout issue. So is there any diabetes medication that might reduce or help treat gout? So I'm hitting two birds with one stone. I'm taking my diabetes medication, and it also helps me with this gout issue. They said, yes, it's the same family.
I just talked about it at the beginning of the episode, the one that ends with the word gliflozin. I told you, you'll be happy when this medication is in your treatment plan or when the doctor includes it in your treatment plan. Medications that end with the word gliflozin, go check dapagliflozin, empagliflozin, I don't know what, Farxiga, Jardiance, the many names, but the most important thing is to refer to the drug's active ingredient and find the word gliflozin. This is a summary of the research without going into details. This graph is very good because it lowers gout levels. I'm not going to tell you to take diabetes medication if the doctor hasn't prescribed it for you.
It's not right. It's not right from a YouTube episode, okay? That you go and get a treatment, a medication, not a dietary supplement or food and drink, and take it. It might not be the right dose for you, or it might interact with other medications you're taking, or it might not be for your condition, and you go and take it.
So, when we talk to you about a medication, what are its benefits or harms? It means that you're already taking this medication and just want to know the information about it. So, for people who have diabetes medications, they should look at their treatment, open the package, and take it out. This is the active ingredient metformin. Dr. Samy and others have said metformin is good and what its advantages and disadvantages are. No, this is pagliflozin or something with gliflozin. So this is the medication that lowers sugar in the urine and what its benefits and side effects are. Okay? This is among its new benefits, as it also reduces the level of uric acid, which helps in treating gout. That's regarding the last topic in this episode. I don't want to take up too much of your time. Let me just see what the Hello, Dr. Khaled Ahmed or Professor Khaled Ahmed. How are you? How are things? I am a fan of your channel. What has science reached in terms of treatment for vision and eyesight? Welcome, Mr. Khaled. May God bless you. Regarding vision and eyesight, of course, the topic is not easy. The subject of vision and this system is one of the most complex systems in humans. Humans and people are limited, and they don't think that we have reached the pinnacle of knowledge and become something. Humanity will not reach the peak of knowledge until the very end, before God destroys the earth and everything on it. The development has become so rapid that in an episode we did, they started experiments on restoring vision in humans. They will try it on some people who lost their sight due to glaucoma or due to what is called sudden vision loss because of optic nerve damage. And this is after they prepared everything on animals and it succeeded. And after they also used the same idea of reviving those dead cells, they used it on corneal cells to make the corneal cells produce and generate a cornea outside the eye. So they moved on to the eye and started working on what? They want to work on the optic nerve. This is the beginning of a new direction. You might say, well, everything starts like this. Remember in vitro fertilization and how centers are now everywhere in the world, on every street, in every city. You find 2 or 3 centers for infertility treatment and whatnot with in vitro fertilization. The first center in Egypt was established in the year 1980. Okay, Cairo was a very strange technology. How do you create this embryo outside, then insert it into the mother and implant it? And it might succeed, and there could be a pregnancy. So in vitro fertilization was a dream and something imaginary 25 to 45 years ago, and now it exists in every country, right? Every city, not every country, you know. So in the development of these things, yeah, the progress now is fast. They're not like before. Don't say, for example, that after 45 years, I will have a center for optic nerve treatment in every city. No, those 45 years in the past, after technology and AI and these strange things become 4, 5, 10 years at most, maybe even less.
A very tremendous and rapid development, so let's not lose hope. And then medical advancements are slow because why? Mistakes in it. I mean, to approve something, it has to be tested on many humans. It's not an easy matter, you know.
God bless you, Doctor. Good evening. Good evening. Welcome, Mr. Sakar.
Professor Sakar says, I'm reading the name because it doesn't show the full name. It shows something like Sakar, which is a summary of the name. He says the treatment you prescribed for retinal bleeding, and thanks to God, it worked for me. Honestly, I don't prescribe eye treatments, sir. I am talking in episodes about the benefits of treatment. It might be the treatment of fluoxetine, which I have done episodes about. I am not an eye doctor, everyone, not specialized in the eye at all. I just come and talk about the latest research on new treatments. All right, so as long as everything went well for you, and of course you should have consulted the doctor and all, but as long as it went well for you and God blessed you, then thank God and pray for us. May God bless you. Professor Munira says, been a very commendable effort, doctor. Thank you very much. You have a valuable collection of research and you need assistance to prepare the research for you according to your directions in a summarized form. Honestly, I mean, I started on this matter, but the process is not easy because selecting the research itself and having someone prepare and understand it, understanding the research, you need to understand the topic itself to explain it. When a young person comes who is not yet specialized, it becomes difficult. So you also need to read the research and study it well. But the preparation of the video and production. Yes, indeed, I wish someone could help me take the video I explained and prepare it, adding supportive elements. And those added things would be a really nice service. Okay, everyone. Someone is saying they tried to contact me to no avail. Look, my email is available on the channel. On this channel, you will find the email. They say this is the only one, and it's the most important thing to reach me. And if you go online and type Dr. Samy Mohamady, British University, it will bring up my page on the British University website. The university email, my email at the university. If you send me there, I only open emails. But as for Facebook, Messenger, or anything else, I don't go to them at all. I didn't even create this channel as an extension on TikTok. Someone just put it on TikTok like that. But neither TikTok, nor Instagram, nor Telegram, nor even the Facebook group, I don't post on them. I haven't posted videos on the Facebook group for a long time. There's no influence in this matter because no one helps me in sharing these videos or in responding to people's comments and so on. And Lala, I deserve an apology. I mean, send me an email either to the university email that you will find on the website of the British University Faculty of Pharmacy or to the Gmail of this channel. Francis says, peace be upon you and God's mercy and blessings. Salem Sabilan or Sablan from Saudi Arabia. How are you, my brother? Hello, and welcome to all the brothers in Saudi Arabia. We want you to pray for us to perform Umrah after Hajj, God willing, so we can pray to God to forgive us and have mercy on us. We tried to go. We were going to go during Ramadan, but these events happened and delayed the process, and then the Hajj season came, and Saudi Arabia completely closes for Hajj, so no one is allowed to perform Umrah. And I wish that the pilgrimage, the part about the pilgrimage wouldn't be every 5 years or so, like the pilgrimage from year 3, to do the pilgrimage again. May God bless you in Saudi Arabia, and may He bless your country, expand your sustenance, and grant you security and peace until the day of judgment. Because this is the secure country, which we say is the pillar of our tent, our pillar, the center from which all Arab and Islamic countries always look to, the place we face in prayer and always seek blessing from. I entrust you to God. And if you like this content, leave a comment saying you liked it, and I might introduce, let's say, preface to research, 5, 6, 7, 10 pieces of research in each episode. And if there is an episode among them that you need or find people really need, we can go into its details and talk about it in detail. Thank you very much, and peace be upon you, and God's mercy and blessings